Internal carotid artery injury has an estimated incidence of 0.1 to 0.3% of transsphenoidal surgeries, but can even occur in just exposing the sphenoid sinus in sinus surgery or endoscopic medial orbital wall decompression surgery. Detailed knowledge of the regional anatomy and thorough pre-operative CT scan assessment is mandatory for these procedures. Mentally combining the peculiar U-turn configuration of the cavernous section of the internal carotid artery that you can see here in this angiogram, with two-dimensional scan slices in the three different planes, as seen in these MRIs with arrows pointing out the carotid, is challenging and takes practice. The internal carotid artery is divided into 7 segments. We are interested in C4, the cavernous segment. This has a serpentine or S-shaped configuration resembling the head of a cobra. The internal carotid artery in the carotid canal extends along the sphenoid bone in the lateral wall of the sphenoid sinus, inferior to the optic nerve. The opticocarotid recess is a variably sized depression between these two vital structures. In this endoscopic medial wall decompression, the sinus work has been done. The sphenoid sinus can be seen through this opening. The scope is entering the left sphenoid sinus. Prompt identification of the opticocarotid recess helps identify the vital structures. The optic nerve sits above the recess, and a very prominent carotid artery sits below it. If you look closely at the carotid artery, you will see its pulsation, suggesting that it has a very thin bony wall and is at risk of damage. The carotid artery bulges or indents into the sinus to a variable degree, and remember that cobra's head configuration, and therefore there can be arterial prominences of variable length, shape, and even in more than one place, depending on which bits of the bend jut into the sinus. Excessive indentation of the artery into the sinus has been called prosidentia. In this case, there do not appear to be any septi attached to it, but it is not difficult to imagine that if there had been, heavy-handled traction on them might easily pull on the wall of the internal carotid, risking rupture. You can see a septation attached to the carotid in the sphenoid sinus in this axial CT scan.